Life is both simple and complex. Our past links us to our present and future. Some of us know our role and purpose. Most of us are trying to figure it out. Join me. Let's figure it out together.
And thank you for joining me. My name is Fritz. I'm a New York State licensed psychologist, and this is a program. It's called the Dr. Fritz Show, or other people know it as Ask Dr. Fritz. And it's a program where we bring you people information and practices to improve the quality of your life. And what I like to do in every episode is just do that. If we're talking about a particular topic, look out for the resources and the people we're going to have on here as guests so that we can, at the end of this, you'll be able to learn something and be able to do something about a problem or a concern in your everyday life. And as I mentioned before, I am a psychologist, and what I do on a daily basis is sit down and talk with people who might be suffering a major challenge in life, a crisis, and we work together to try and figure out what that person can do to help them get through that tough time. And I like to use this program as an opportunity to provide that kind of information as well to people. So during this episode, we're going to be talking about suicide and suicide prevention. And so what we're going to be talking about today really is, and what I want to focus on, is survival. Talk about prevention. A lot of programs will talk about suicide, but what we really want to focus on here is what you could learn about and focus on to do if you are someone who's suffering from depression and thoughts of suicide, or you know somebody who is in that situation. Are you a parent with a child who's suffering and don't know what to do? Stay tuned, because we're going to be talking about that. My first guest on this program during this episode will be Libby Trainer. She is the Chief Clinical Officer at Staten Island Mental Health Society, and we're going to be talking about suicide and suicide prevention, particularly in children and adolescents in her organization. So I'd like to welcome to the program Libby, so we can just jump right into the topic and get started. Libby, welcome to the program. Thank you for coming.
Thank you so much for having me.
So tell us, a little bit about you and about Staten Island Mental Health Society, because I've heard about this organization for years. I work as a private practitioner, and I'm often referring serious crisis cases to your organization, but it's the first time I'm actually getting to sit down with somebody from the organization to tell me about, what you guys do.
Wonderful. Well, thank you so much for having me here. I think this is a great opportunity to get information and education out to the community about such an important topic. I am from Staten Island Mental Health Society, and Staten Island Mental Health is a very large organization that helps children and families. We've been around for 120 years. This is our 120th year this year in 2015. And what we do at Staten Island Mental Health is provide behavioral health services in the areas of mental health, substance abuse, and developmental disabilities. We also have a very large Head Start division. We provide services to about 1 in 10 families on Staten Island every year, as many as 230,000 services by 300 professional and support staff. I've been with the organization for 16 years. I found it, I loved it, and I've stayed all this time and risen through the ranks of different programs to lead all the behavioral health. So it's a real honor to be leading this organization. It's an incredible organization that does an enormous amount of work and good for the Staten Island community.
Okay, so let's start at the top and talk about, we have a lot of our audience obviously is from Staten Island and watching in Staten Island. Let's talk about let's get into the signs and symptoms. If you're a parent and you have an adolescent, what should you do? What are the signs that we should be looking for as parents?
Right. I think that the education around warning signs is absolutely essential, and it's not just for parents, it's for teachers, for anybody who has a relationship with a child or a young adult, to really understand how children communicate their internal emotional world. And the most important sign and symptom, which really is kind of a glaring one, is something that's written, some kind of a note that is describing that the child or the adolescent doesn't want to live anymore.
So let's say you're cleaning your parents' room, or you're going across something, you see that they've written, let's say, a poem or something that indicates that they don't want to live anymore.
Right, and that's a little bit more of an indirect written note. Oftentimes children will express their emotions through artwork, through their writing. A lot of times teachers will identify themes and patterns in their writing that could have a lot of themes around darkness and death, drawings that are very graphic in terms of death scenes or knives and guns and things of that nature. So it can be a little startling.
Now, a lot of the material and themes that I know children are looking at these days, video games can be very violent and very graphic. How do we tell the difference between that and really a child's cry for help?
Well, I think that you take everything in context of that child's life. So some of those other warning signs are, has the child made a lot of verbal threats? Is it part of the vernacular to say, I just want to die. It would be better if I wasn't here anymore. Those kinds of statements, along with, some of the other warning signs, with the theme. So it's not any one particular warning sign, but a group of them together. Of course, any kind of a previous attempt, is the greatest warning sign of all. But sometimes those signs can be very subtle. And it's a change in behavior, a change in their friends, and who they're hanging around with, who they're talking to, spending a lot more time alone in isolation, a change in their hygiene, not taking care of themselves as much anymore.
So as you go through this, and we should talk and expand upon some of these warning signs, but it's important, I think, for us to also highlight that it's not just one thing that we usually find. It's usually a cluster of symptoms or warning signs that might be subtle, but nonetheless, they come in aggregate. So it's not like we're just finding one drawing and then everything else in life seems like it's normal and the same. But when we take a closer look at it, we're finding a lot of symptoms. Because I think a lot of people believe that suicide and suicidality comes out of the blue and can be even inspired by even asking the question. Right,
which I think is the greatest myth, that if we can get that across today, is to debunk that myth. The myth is that if you talk to your child about suicide, that it'll put the idea in their head. And it's all evidence and research to the contrary. Parents and adults who talk to children about suicide are at less risk of attempting or completing a suicide than those who do not.
So asking the question does not put the idea in their head?
Absolutely not.
Conversely, what does it do?
It opens up a dialogue. When your child comes home and says, I just want to die, I failed the math test today, to take that as a teachable moment and say, whoa, what do you mean by that statement? What does that really mean? And for a child who's got that level of pressure and anxiety, that a failing grade very well could be a trigger to an event. But it also could be a child taking that vernacular to an extreme. No, Mom, I don't really want to die. I just said it, because I'm so angry about the math test. But it's an opportunity for the parent to say, well, making that kind of a statement is a very severe thing, and I care for you and I love you. I would never want anything bad to happen for you. If you ever felt really upset to the point where you wanted to hurt yourself, you can come to me.
So your response there actually highlights what we want to be able to do, because we want our children to be able to come to us with anything.
Yes.
And even if it is as serious as wanting to hurt themselves, we want them to be able to come to us and provide a safe place for them to express themselves. So if they come to you and you sense that something may be going on and you ask the question, I've heard children say that actually asking the question showed that this was a safe person they could be talking to, and they actually felt relaxed that they were able to talk about that and express it and not have the person just shut down. Or, I mean, in the old days, I think people would actually tell you, don't talk like that.
Exactly. Exactly. And all research has shown the more that you're able to talk about your child's internal emotional life, And topics that are really difficult, such as wanting to hurt yourself or wanting to die, is actually preventive. And it really does open up that dialogue. And you as a parent, you have to have that strength and that trust to say to your child that we can talk about this and other hard topics. I think for parents it can be really overwhelming. No parent wants to think that their child could actually do something to hurt themselves, so they're scared. And they're scared of what the answer might be. And I think they're scared of what the answer might be because they don't know what to do.
So let's talk about that part, because okay, your child expresses wanting to hurt themselves. What should we do?
Well, first and foremost is safety. So if your child is expressing a suicidal ideation, you need to secure them in a safe place, and that is not leaving them alone. And you can do that also by taking them for an evaluation. And here on Staten Island, Richmond University Medical Center has a psychiatric emergency room, and one specifically for children. And that's where you would go for an immediate evaluation. I think that it's very important. It sends a message to the parent and the child that I care for you, and I'm going to make sure that you're safe, and I'm going to make sure that you get the help you need. You would do the same if your child fell down the stairs and broke their leg. You would call the ambulance and you would go to the hospital. And this effectively is really the same thing. It needs immediate attention. And I think a lot of times because of parents' fears, they'll say things like, well, you don't really mean that, do you? And then the message to the child is, oh, I shouldn't have said that, and will then deny or recant.
Is there any language that we can even put in the parents' hands to even help with that initial dialogue? Because I got to say, there's a lot of dramatic television that I know children are watching, and sometimes I even hear my kids say things. They haven't said anything like that, but they'll say things that sound like they're right out of one of those Disney shows that they're listening to. So is there any kind of line of questioning that we can, or safety in space to let them talk, that we can create for them so that we can really flesh it out, so that we can tell a difference between a theatrical line that's being repeated and a real cry for help?
Well, I think it's really important for the risk assessment to be done by a professional. So I don't want to put the line of questioning, for parents, to evaluate. You have to realize that as a parent, you're not objective at all. And you need to have a professional do that kind of evaluation for you. But what you can do as a parent is when you see these warning signs, you see the isolation, you see the change in friends, you see the poor grades, is to sit down and talk with them about your observations, and not to make a judgment statement, your grades stink, what's wrong with you, as opposed to, you were doing really well in social studies and I see that your grades are slowly dropping, what's going on? Is there something mom or dad can do to help you? Is there something that's getting in the way of, your school performance? And oftentimes, it will come out that there is a problem, usually a social problem, or to be very direct, and that starts at a very young age. So in terms of prevention for parents with young children, is the daily check-in. How was school today? And being very present with that conversation. Who did you sit with at lunch? What kind of games did you guys play at recess? Did you feel good today? Did anybody hurt your feelings today? And opening up that kind of dialogue when the child's in kindergarten and first grade and second grade builds that rapport that you're so engaged and interested in their emotional life, so that when they're 13 and 14, that it's not an unusual, uncomfortable conversation.
They're used to talking to
They're
you
used
and
to talking to you and opening up. And part of your job as a parent when you have those young children is to help them to express those emotions. They don't necessarily have the language yet. So, the kids kind of default to sad, mad, and happy. And they don't necessarily know the subtleties of being annoyed or being frustrated, or some of those higher level kind of language to describe what they're feeling. And it's a parent's job to help to develop those skills and to develop that language so that they have an ability to express themselves in a way that can be understood. It also will reduce some of the behavioral acting out, because when kids don't know how to express themselves verbally, it turns into behavior problems at school. You know, so those are.
So you're talking about really over the relationship between a parent and child, the creation of a safe place where the child feels comfortable being able to come home, have a dialogue with the parent. It's a curious dialogue where the parent is really getting curious about what's happening with the child, so that you develop the rapport with your child, so that when there are changes, when something's going on in their environment, you're going to be able to pick up on it. And the subtleties may not be so subtle to you if you've been doing that all along.
That's right. That's right. And yeah, I think what's also very important, if you do have a child that is struggling with depression or that you have some concerns about, is a very concrete tactic, and that is to suicide-proof your home. And that means, you know...
Suicide-proof your home. Tell us more about that.
Well, something that we recommend immediately to families, you know, oftentimes we'll receive a referral from the hospital where a child's gone for either evaluation or a stabilization. They've made a gesture or an attempt, is to do some concrete things. You know, look through your kitchen, look through your house, your medicine cabinet, and put those things away with a key, with a lock and key.
So take out of impulsive reach
Yes.
the kinds of things that somebody can do harm to themselves or others if in that state.
Absolutely. And, you know, another important kind of concrete, a concrete thing is to really get very involved in your child's school life, to understand, you know, what's happening in that building for those 5-6 hours a day, both, you know, academically with the teachers and, you know, with their social life. It's very important to know your child's friends, you know, and even as they grow into adolescence, you know, the worst thing in the world is mom and dad hanging around. But to know your children's friends, invite them to your home, you know, give them an opportunity and a chance to say hello to them. Oftentimes it's the child's friend who will give you a clue of what's going on with your own child. And listen very carefully. Again, adolescents are subtle. And, you know, if the friend is concerned, they will drop a hint to a parent. So, again, being present and around and available and engaging is you know, not just with your child, but with your child's social circle as much as you can. Be the mom who carpools. Okay? There's something amazing about what happens in a car. It's like the parent disappears and the conversation goes on around you.
Oh, and they start talking about things and they forget that you're there.
They completely forget that you're there.
Okay.
And it's a window into your child's life and, you know, an opportunity later to engage your child around, you know, what you observed.
Okay, if you're just tuning in, my name is Dr. Fritz here. I am sitting here with Libby Traynor. She is the Chief Clinical Officer at Staten Island Mental Health Society. We are talking about suicide prevention, and I want to stress prevention because suicide affects so many people every day, every week, every month and year in this country, and there's a lot that we can do. I can't stress more than highly enough that this is preventable if we get the education out there, if we collaborate, we get this information out. I do want to shift gears a little bit because if somebody is watching right now, you're a parent or you know a child that is in distress, let's talk to let's recap on what somebody could do if you're noticing this right now, because the good stuff we're talking about here is the building of relationships, the creation of a safe home and space for the parent to really get to know their child so that they can really, you know, notice the subtle changes and notice the risk factors and notice their decline. But what happens if someone's watching this right now and they think they've got a situation? What should they do?
If you're in crisis yourself, you should go to the emergency room. That's the place where you need to be to seek the proper kind of evaluation and psychiatric care. If you're a parent of a child and you're here on Staten Island, you know, that location would be Richmond University Medical Center or Staten Island University Hospital, where you can go and get an immediate psychiatric evaluation. In the other boroughs, any of the other hospitals are available with the same type of service. If there's not an acute distress and you feel like, my child needs help and would like to seek some therapy and counseling, again, there's a number of private providers on Staten Island, as well as our organization, where you can take your child for what's called outpatient therapy, where you'd meet with a therapist and develop a treatment plan to help really get at the underlying issues that are causing, some of these thoughts and behaviors around, harming oneself. And seek a psychiatric evaluation in a clinic setting or a private office setting.
And one of the most important things that you really need to do, if you sense something, you see something, say something, ask, get involved, because there's so many situations where people were for so long going on and having certain feelings and nobody actually thought to ask them.
That's right. That's right. Something that's happening right now in the public schools here on Staten Island and throughout the city is a number of the school nurses in the middle schools have been trained in how to assess for suicidal ideation. And this, for a child's life, the home life is important, but the school life is equally as important. And to know that there are so many resources available in your child's school. There's a school psychologist, there's guidance and social workers, as well as the school nurse. And oftentimes those behaviors and those thoughts emerge during the school day. So helping your child to understand where they can seek help within their school environment is very important too. Something we haven't really touched on is bullying, and that's a big issue with regards to a child's emotional state and feeling as though they may want to harm themselves, and that usually is happening in the school setting. So making sure, again, knowing what's happening in your child's life and making sure that your child knows how to seek help and who their safe space is within the home setting or the school setting is really very important.
So along the lines of the child knowing how to seek help, do you think it's important maybe to even have that conversation with a child where if they ever were feeling that way or in any kind of distress to go over with them what avenues they could seek?
Absolutely, and I think we teach our kids lots of different things as parents, and I'm a parent of 2 small children as well, and knowing how to handle situations, as they arise and where to go empowers children, and it makes them feel that they can do something about it. And the horrible part of suicide and suicide ideation is that there's the sense that there is no hope and that there's absolute desperation. And by empowering with information and education, you can counteract some of that despair with, well, I know that my mom loves me, I know that my dad loves me, I know that if I go to the nurse or if I go to the guidance counselor, someone's going to be there to help me with how I'm feeling.
And your children really need to know that.
Yes,
They need
they
to
do.
know that it's okay to ask for help. Just like we
Yes.
tell them, if you're walking down the street, a van stops, don't get in, don't talk to strangers, say no.
Yeah, look both ways before you cross the street.
Right, we've got to have those sessions with them where we talk to them about where to go if someone's bullying you, if someone is upsetting you, if you're having thoughts about wanting to hurt yourself. We
Right.
need to get that in their minds, because a lot of people, there's a stigma around asking
Yes.
for help. People feel like it's wrong. I mean, adults feel like they're afraid to ask questions about if a child wants to harm themselves. People are afraid to ask questions. A lot of professionals are afraid to ask that question. And a lot of people have gone on for a long time with those feelings and nobody ever checked in on them to see how they're doing.
That's right. That's right. It's just very important to take immediate action. In treatment and in therapy, we say strike while the iron is hot. And crisis is the greatest opportunity for the greatest progress and intervention. So, when the child's feeling that low or the parent is that concerned, that's the time, not tomorrow or next week or when it fits into the schedule. I'll give you a very clear example of something that happened fairly recently in the clinic. A very young child right before the holidays came in to the clinic, about 7 or 8 years old, a few days before Christmas, and had a breakdown with the therapist in session, saying that he wanted to die and that he was being bullied at school and he couldn't take it anymore, and nothing could lift this child's spirit. We could not, the clinician was really working with him to try to help him to calm down and gain some control. When we spoke to the parent, of course the parent was very upset and really struggled with this idea that she would have to take such a small child for an immediate psychiatric evaluation. But what was really apparent and became very tangible for the parent is to understand the level of despair for the child. The child couldn't have cared less if Santa was coming. And for this particular parent, it finally struck home how serious it was and how she needed to take immediate action. Because what 7-year-old child, 2 days before Christmas, isn't excited about the prospect of Santa coming?
A child that's in a lot of pain.
A child that is in absolute despair, in absolute despair. And it was very clear that immediate intervention was needed. But it's hard. It's very hard for a parent to grasp, that they need to take that step. But that's the job of a parent.
But the upside of really addressing this and taking care of this is that we're saving lives.
Absolutely, undoubtedly. That is the ultimate responsibility of a parent, is to provide that safe, loving environment, at all costs.
Yeah. And that also underlines what I'm saying in terms of like hope and prevention and survival beyond these feelings, that there are so many resources. When you do an internet search on this topic, there's so many really reputable resources that come to that top page. Frequently asked questions, statistics, warning signs, all kinds of resources that are available. And it's interesting that it's a topic that we stay away from, and it's so easy to find lots of resources. This is a very preventable thing that we have here, and there's a lot of resources that when we're collaborating, we can do a lot.
Absolutely.
So, do you have any final thoughts before we finish?
Well, I think that one area that's really helpful in putting what they say, putting the tire to the road,
yes,
for parents, is doing a role play with your child. And if a child's being bullied or if a child's struggling, with their social interactions, is to play that out at home. Say, you be the bully and I'll be you, and then switch roles and have them practice. Have them practice how to handle different situations and what would you say, and give some suggestions and then practice it again, so that your child is equipped not only with a knowledge